Assalamu alaikum. Welcome everyone on board. The purpose of today's discussion is just to give you an idea how to construct an answer in a scenario-based question. Whether I wrote a Viva, but actually same principle will be there if you even if you are answering a scenario-based question in because some exam patterns are of SAQs. Okay, so the basic principle remains the same. So I would like the exam. Zishan Akbar, are you the exam candidate for the recent exam? Please, the exam candidates, raise the hand. Fatima, I know Ali Raza are also, you are also exam candidate. The ones who are exam candidate, please raise the hand. So I will preferably ask them to answer. Zishan Akbar, are you exam candidate?
Yes, sir.
Okay, so we will start. So, purpose of, this Umar Al you are writing on the screen, so it is creating a distraction to me. Please, Mr. Umar Al Hatlal from NGHA, please, you are marking with the red pen, please. Uh, okay, thank you. So okay, so actually the usually whether it is a table viva or it is a long case, the basic purpose of creating a scenario based actually is that they will give you some data. Okay, so data will be, I'm giving you an example. In long case, the data will be slightly having more than one problems. In table viva, or you can say short cases, in some exams they are being called, there will be uh, relatively less problems. Okay, but a default will be like a diabetic, hypertensive, old, it is 80 years old. Okay, for TURT surgery. Okay, so Zishan, I will ask you to take the lead. Generally in any, like, because some of the people who are listening maybe are going for FRCA or EDA, the same principle will be there. Okay, same principle will be in any exam. The basic principle is the same. This is a sample scenario that you have a diabetic hypertensive 80 years old man for TURP surgery. Okay, so the basic, they can ask you in a different way, that how will you evaluate this patient. Okay, they can ask you how will you manage this patient. They can start you like this question, the similar question they can ask the relatively irrelevant, not irrelevant, but relatively, you can say, just like we go to a restaurant and we order a starter. So starter can be that in TURP surgery, what are the various solutions. Okay, they can make any sort of, but the basic thing is that the questions style may be different, but actually you need to give them an idea that how will you make this patient ready for the surgery, and it will be all the perioperative care of this patient. Okay, and they would like you to just give an idea that what are the considerations or what are the things to do in such patient, a diabetic patient, a hypertensive patient, an old age patient, with the patient who is coming for TURP surgery. Okay, so let's start. So Zishan, would you like to answer, please?
Sir.
So first
Sure,
question is
sir.
that how will you evaluate this patient? You are evaluating this patient, an elective surgery, diabetic, hypertensive, 80 years old for TURP surgery. Remember that total time for this, including all the recipe, all the question, will be around 5 minutes. Okay, so make sure
Sir.
that you are able to give all the important things in 5 minutes. Okay, so how will you
Sir,
evaluate?
just I will describe in yeah, sir, question answer sir मैं करूँ.
No, no, I will tell you. Try to speak in English. This will be a practice for you as well. And my first
Right, sir.
question is that you have this patient feel as if you are in the exam. Okay. So I have
Right, sir.
given you this data that you have a patient who is 80 years old. He is diabetic and hypertensive, and he is going for TURP surgery. How will you evaluate the patient?
Sir, I will evaluate the patient on the basis of the history examination and his lab investigations. And first, I will start the investigating his the symptoms of the urinary symptoms and their condition. And if he is taking medicine for this, and response to the medicine or failure to the medicine response, then I will take the history of his comorbids that are obvious as a hypertension and diabetes. And I will go systematically by asking his the duration of the comorbid
गुरु ये शायद
and
यहाँ पर करना सबमिट करना शुरू
Okay.
medication is what medication he is taking and compliance to the medicine. And I will further dig out his
Till now, sorry,
related to his
Zishan,
health.
I will have to interrupt you. You have gone with one minute and you have not told anything meaningful. Have you told anything meaningful up till now?
Sir,
Now the examiner will become irritated. You have not told anything meaningful. This is my response. What have you told up till now
sir,
in 1 minute? You have only told about urinary
sir,
symptom. Is urinary symptom related to you?
his sir BPH. I will
No,
evaluate
no.
his
Is it
on
related to you
history, sir.
or
I will
surgeon?
surgeon, sir.
What have you told about diabetes or hypertension? What you should
Sir,
be looking in.
diaper,
If I told you that I'm a diabetic and hypertensive, what you should be thinking?
sir,
Like your aim?
I will do. My aim is to determine whether his diabetes and hypertension are controlled or not controlled, and their severity, sir. I will determine their severity of the disease, or and I will decide on history and examination that either I have to optimize the patient, or I will go with the surgery on
Okay.
the history and.
Can you see in the screen what I have
In
written?
sir.
Have you said anything about it?
Yes, sir.
Because
Sir,
you have to be meaningful. That's what I told you, that in 5 minutes, you have 5 minutes and you have lost 2 minutes and you have not told anything meaningful up till now. Okay?
sir,
And that is the problem which
sir,
which is real time problem in the exam. That you have to start your answer in a meaningful way. That I will evaluate the microvascular and macrovascular complications of diabetes and hypertension resulting in an organ damage in. Now you can tell the organs. What are the organs? The organs are heart. The organ are
art as
brain. The organ
CVS
is
and sir,
what else?
eyes or kidneys,
Kidneys,
eyes or
eyes.
neuro.
Yes. So now what were you saying before that?
Sir,
Got my
I was
point?
just
You were just
yes, sir,
trying
got.
to you were just trying to have waste of time. Okay? So
Sir,
now
right.
again please try. I will give a chance to everyone. Please, now again, you have 1 minute. You have only 1 minute and you have to answer this thing. You have 1 minute only.
Sir,
Okay, your time starts now.
sir, I
Evaluation.
evaluate my sir, I evaluate my patient on the basis of history and examination. And in my history, I will ask about duration of the my comorbids, diabetes and hypertension, duration, the medication he is taking, and the severity. And then I will dig up about the its complications, macrovascular and macrovascular complications, and I will evaluate the and systems, including his central CVS, CNS, and peripheral vascular system, and microvascular complications, including retinopathy and nephropathy and autonomic dysfunction and peripheral nervous system dysfunction. and then I will ask for his physical
Okay, okay,
status
just let me
and
stop you.
problem.
Your time is finished. Your time has finished and you have not even finished the history.
Sir.
Are you understanding what I'm sorry, but this is the problem, that in the exam why you will be in trouble, because again you
Right.
have wasted 1 minute and you have not even finished history. You don't have to tell like this in exam, my dear. You don't have time. You have to tell meaningful. End organ damage, what occurs if a microvascular and macrovascular complication occur. Combine history examination and investigation, what you will be finding. You will find, first of all, any history of stroke, any history of TIA, any sign symptom related to cerebral vascular disease, any sign symptoms related to heart failure or ischemic heart disease. Okay, any problems with reference
Sir.
to eye, any problems with reference to kidneys, that's what you have to tell. And of course it will be based on the you will just say only one word, what sort of management patient is taking. Zishan, I mute you by mistake. Can you unmute
Sir,
yourself,
sir.
please? Yes. So
Yes.
like you don't have time, okay? Because if there is, Doctor Himonot, please can you mute your mic, please? Keep your mic mute. Okay. I hope you understand.
Sir.
Okay. So now I will give a chance to someone else, please. Wajiha,
Yes, sir.
Atif, you will be next. Okay, please try to answer the same question.
So, a diabetic hypertensive 80 years old patient presented for TURP surgery.
Yes, how will you evaluate? The first question is, how will you evaluate this patient?
Sir, his demographics in a line and his history of presenting complaint, वो जो उसको TURP है वो उसको उसकी symptoms क्या है, उस prostate का size वो मुझे उसका
Try
पता
to
चल
speak in
जाएगा.
English, Wajiha. There are
Okay,
some
sir.
people who are not understanding our native language. So please try to speak in English.
Okay, sir. And then his the associated comorbid conditions and complaints for diabetes, its onset, when it was started, what drugs is he taking, and compliance of the drug, and his control of blood pressure, and along with his routine medications and his record of blood sugar chart, HbA1c or labs will be discussed further. Or hypertensive may be same, or both key end organ damages related to both hypertensive and diabetic. If microvascular macrovascular complications are associated for in macrovascular heart, cerebrovascular, and peripheral vascular disease, or microvascular includes retinopathy, nephropathy, or third one I'm not remembering at the time. And then both for hypertension and diabetes, and any previous anesthetic history, and any drug allergy, or his meds, and so I will evaluate his ASA class according to my findings, and then I'll chalk down my his routine medications, and then describe the labs awaited, and what further labs will be needed. And so in labs, I will be requiring his CBC, RFTs, LFTs, serum electrolytes, ECG, chest X-ray, um, and HbA1c if available, or a urine complete examination.
Okay, so Wajiha, you are doing the same mistake which Zishan was doing. You try to understand this thing, and this is the practice which you have to done, and you cannot learn this thing by reading even Barish or Miller or Morgan or whatever name you name, any bloody book. You cannot, unless you speak out. Listen, I go back to from where I started. They want you to tell them that in this case you are evaluating a patient, my dear. So you just have to tell that I will evaluate on the basis of history examination and investigations How much is the severity of diabetes, hypertension, and related problems. Okay, so your aim is to rule out microvascular and macrovascular complications. So you will be looking at any sign symptoms related to heart failure, any sign symptom related to cerebral vascular disease, any heart sign symptom related to peripheral vascular disease, and if there is any symptoms, you will go investigations accordingly. If there are some eye symptoms, you will refer the patient for fundoscopy to see any retinopathy. If the patient is having long-standing diabetes, the patient can have nephropathy, so you can have ultrasound and urinary examination. With reference to meds,
Yes,
if the patient
if
does not have good meds, you will have this one an invasive testing with ECG and then echo, or if needed, thallium scan, according to the situation. Okay, so this is the answer,
yes,
not the answer you people are telling.
yes,
Okay,
sir, like if
like
he is
okay, I give further question. That this data I will write. The HbA1c is 9, the blood pressure is 150 by 90, and you cannot assess the meds because of the knee pain. Okay, so what is the ASA status of the patient at the moment?
sir ASA 3
ASA 3. Okay,
uncontrolled.
okay, so which investigation would you like to refer with reference to? You have done ECG and no significant changes, but you cannot assess the meds because patient cannot move too much because of knee pain.
Yes, sir.
So
Sir,
would you like echo, resting echo, or
oh, dopamine stress testing.
stress echo? Okay,
Yes, sir.
stress echo or stress
Thallium
thallium.
scan.
Okay,
Yes, sir.
and just tell me one thing: what sort of surgery TURP is? Is it a high risk surgery, intermediate surgery, low risk surgery?
Sir, intermediate.
Intermediate. Okay, so intermediate risk surgery, and you ask, and the diabetes, as you were saying, that you were saying, telling the right thing, even Zishan was telling the right thing, but you were over stressing and you just have to finish in few seconds. That what sort of medication patient is taking, how is the compliance, and how is the result, what is the blood pressure, what is the HbA1c. Okay, and then you find that it is insulin dependent diabetes mellitus, and then you again another data you found that patient has a history of TIA. Okay, so history of TIA, insulin dependent diabetes mellitus, intermediate risk surgery. Now you will go for stress echo and stress thallium. Okay, and then again you have to say few words about TURP. So you will be asking. Okay, anyone else, please? Fatima, are you with me? Can you tell me what surgical question would you like to ask with reference to TURP?
The size of the prostate,
Very good. One
uh,
question. What
and
else?
uh, and sir, the
Technique?
condition of the disease, how much? Yes, sir.
No.
Technique.
Technique. Anything else?
Um,
Any hydronephrosis?
o- okay. Any hydronephrosis, or and I will ask if it is a benign or it is a cancerous thing.
Okay. Usually
I will
they are
evaluate this in CT scan via CT scan.
yes, PSA. You can ask about PSA
Yes, sir.
levels
PSA level. Yes,
because
sir.
the TURP now you are focusing only the surgery. Okay. So with reference to
Yes.
surgery, what is the size? What is the technique they are using? Because why this technique is important? Because now they are doing laser. Okay, now they are using a technique in which they are not using the glycine, so it's a possibility. Okay, so you have to ask how much will be the resection time. Okay, because resection time will tell you a lot of things. A lot of complications which can occur is because of the resection time. Okay, so
It
now
will
now
depend
we will
upon the size of the it
yes.
will depend upon the size of the prostate.
Yes. So, of course, remember one thing. You just have to give them a starter and filler. If they want to ask you something in detail, they can ask you. But any scenario based question, you have to speak out few words about the surgery, few words. Okay, this can you can tell in 30 seconds. No, you don't need to have a big answer. Okay, so you will discuss with the surgeon about the prostate size, if what technique he's being going to use, if there are any hydronephrosis, if there is any possibility of prostatic cancer. Okay, so these are the things which are important. And some more points about this surgery is very important is lithotomy position. Whether the patient can develop lithotomy position, is there any restriction to it? Because if they cannot do then it will be a problem. Okay, because now if you just explore this, so the same scenario can come in a long case. Okay, the same scenario can come in the long case, and then when you are taking the history, the same things you will be asking a little bit detail, and you will be examining the patient a little bit detail. Yes, Wajiha, you want to say something?
Yes, I want to ask that I should practice on the questions, that if about complications, I should be practicing with the speaking that what are the urinary symptoms, or what are the heart, like orthopnea, PND, or
Yes,
SOB, the
yes,
same.
yes. Heart failure, 4 or 5 symptoms: SOB, cough, okay, chest pain, orthopnea, PND. Okay.
And likewise
So
about kidney
even you don't
exercise.
need to, in table viva, you don't need to start with, you don't need to tell each and everything. You will start with this answer. I will evaluate the patient on the basis of history, examination, and investigation. And my aim is to rule out end organ damage in the patient. And my focus will be to look on to rule out retinopathy, nephropathy, ischemic heart disease, cerebrovascular disease. And if they want to ask further, they will ask you further question. Okay, or you should practice and actually remember one thing, because there is no exam which will finish without diabetes and hypertension. So you can make, even you can cram answer and you throw out that answer. And you should know that retinopathy, any visual field defects, and you will refer the patient to ophthalmology to do the fundoscopy to see the retina. Renal problem or long-standing diabetes, you will make a urine RE, you will do ultrasound to see is there any renal failure. Okay. And similarly, heart, you will see the mets, you will see the chest pain, any signs of failure, and then you will do ECG. If any indication, any risk factors, you will go for stress testing, echo or thallium scan. This should be what. Just tell me one thing: how much time I will take to answer this question? Because remember, 5 minutes. Please put the timer and answer. Try to practice the answer, because you people are. I will take history. I will do examination. I will take history of this. I will take history of that. No, no, not at all. Okay, Zishan, I hope you understand.
Sir, got it.
Okay, now please, Atif, can you add on something to what we have discussed? Because some of the questions, they can ask you what sort of fluid. This is a cramming answer. I don't remember the fluids. You should know what are different fluids. They can ask you about glycine toxicity. They can ask you about another thing. Now a practical question. They can ask you about hyponatremia. Okay, how will you identify? You have given spinal. Okay, they can ask you spinal versus GA. They can ask you some question about it. What are the advantages if you have given GA or if you have given spinal? And then a question is probable question will be that what are the factors which increase the absolute absorption? The factors are written. How much should be the height? How much should be the duration? Okay, and size of the prostate, duration of the surgery. These are the things. And about the some that what will be the sign symptoms in glycine toxicity, what will be the sign, how will you pick that the patient is going in fluid overload? Okay, so what should be your answer? Yes, Atif Nazir, you did not participate. Please, would you like to answer?
Yes, sir, sure.
Sure. How will you pick the patient is going in overload?
Okay, after having given spinal anesthesia, for overload, the patient will have apprehension, restlessness, shortness of breath, and the patient may develop hypertension and
Hypertension or hypotension?
hypertension
Both,
or hypotension
both can occur. Bradycardia can occur.
and bradycardia.
Like there may be any change. Okay.
Yes.
So then what we will do?
And depending upon the severity of hyponatremia, which occurs simultaneously because of dilution, patient
Okay.
may exhibit the CNS signs starting from just restlessness to confusion and stupor.
Okay. So what you will do immediately, you will answer in the same way like any complication. So what you will be saying, my approach will be
Uh, my approach will be simultaneously assessment of
very
the
good,
patient and managing the patient based on ABC approach. I will ensure an adequate unobstructed airway with
very good.
adequate ventilation and oxygenation, as well as
Immediate.
adequate
Yes,
circulation.
I'm sorry. Just to interrupt you, just to tell you, make a habit, call for help. You can say immediately, and you can inform the surgeon immediately. Okay, to finish the
Yes.
procedure as soon as possible, because the precursor will be that already duration would have been long. But actually, this is not only factor. The absorption can be because of any other factor. Okay, so this is something. So you will be saying that you involve the surgeon. Yani, listen, in any complication, remember the word call for help, airway, breathing, circulation, and remember the word stop. You may need to stop some infusion. You may need to stop
I'll stop
something,
IV fluids here.
or you will stop the surgeon. So stop, remember the word stop. Okay, so and then you will be further, you will do ABGs. Okay, you will send the labs for electrolytes and
Serum
everything.
electrolytes and blood
Yes,
gases. I'll diurese the patient if there are signs of volume overload. And depending upon the severity of hyponatremia patient, if patient is fitting and has seizures, I might consider giving diazepam or magnesium.
airway. Okay, you will manage the airway in this case. You will put endotracheal tube. You will secure the airway. Okay, and then according to the uh, probable volume status and probable sodium, you will calculate how much you need to give, what you need to give. What are the different options? Diuresis is one option. What else?
Hypertonic saline,
Hypertonic saline is one option.
mannitol.
Mannitol. Okay, so like you will go and your option is to not point millimole per hour, I think, things like that.
Yes, sir.
Okay, so if you do it quickly, then it can result in shrinkage of the brain and all the complication they can ask you. Like, I hope you understand these answering these question is not a problem. Okay, the problem is where I stressed much, that when they will be asking you this question, the only thing is that how you start your car and run. When you run, then no problem. The problem is that you will stuck, and they have to ask so many questions, and you are stuck in the start. And you are saying, I am taking history. Your history examination will not finish in 5 minutes. So I hope you understand, all of you. Fatima, Zishan, Wajiha, I hope you understand what I was stressing. So your aim, any scenario based question, you have to answer in a way that you cover everything in minimum words. Okay. So now you think some other complication, bladder rupture. Okay. Sepsis. Okay. And then if it is not directly related in TURP, but if it is TURBT, then the lateral wall and the obturator reflex, they can ask you question about it. These are possible questions which they can ask you in this scenario. They can ask that in the post-op period, bladder is ruptured. How will you identify? Because you have given spinal, so sometime you can miss. So maybe there may be hypotension, there may be distension in the abdomen. Okay, so even if they don't ask, you have to tell about these things. For sepsis, you need to give antibiotic at appropriate time before the surgery. This is one thing. With reference to bladder, you have to make sure that your level of anesthesia is T10, not too high, because if it is too high, maybe you can miss the bladder rupture. Okay, and because there will be free fluid in the abdomen, so you have to identify this thing and you have to act accordingly. If bladder rupture, also because of vagal stimulation or because of distension, there may be vagal reflexes. So sepsis, TURBT, and these are the possible questions. So as a summary, I again repeat, you have to identify three things in this patient. Like, we did not discuss about elderly, so you can finish your answer, because maybe they don't want to ask you about elderly all the details. Okay, so you make your answer. The elderly answer should be like pregnant, like pediatric. Your answer should be, there are physiological, pharmacological, and anatomical changes in elderly patient resulting in challenging anesthesia management with reference to airway, with reference to induction, maintenance, and recovery of the patient. If you are repeat this, I will repeat it again. There are physiological, pharmacological, and anatomical changes in elderly patient leading to challenging anesthesia conduct with reference to airway management, with reference to cardiovascular reflexes leading to sudden changes in hemodynamics at recovery and induction at induction and recovery. And then you can tell few things, lower level of MAC and some of the thing difficult IV, and these things you can just. So your answer, you should prepare a 30 seconds answer for this thing. If they want to ask something in detail, they will ask you, but if you tell these words, that will be enough for you. Okay, like can someone answer, practice, just for practice, similar answer, who will speak out in 30 seconds? Elderly concerns, please. Fatima.
Sir, there are concerns related to the elderly age, like geriatric concern, which include physiological changes, anatomical changes, or pharmacological changes in elderly patient, which will lead challenging anesthesia in airway, challenging CVS involvement, hemodynamic instability. So it would be in respiratory system there can be a decreased FRC. They become quickly
Desaturate.
quickly
By the way,
hypoxic. They are
Fatima, sorry to interrupt you. FRC does not decrease in elderly.
sorry, decreased closing capacity.
Closing capacity
Decreased
decrease, and it reaches the
closing capacity
FRC.
is decreased.
It reaches
Yes,
FRC.
closing
Okay.
capacity encroaches FRC, so there is they become hypoxic quickly, and they are edentulous. There is a decreased mass of the oral cavity, so there is difficult mask ventilation. There can be difficult intubation due to some joint involvement, or there are different concerns related to if they have any CNS involvement, like previous history of a stroke, and if there are cognitively
Okay.
impaired.
So sorry to interrupt you,
There
Fatima.
are
I hope you got my point. Okay. That, like, for example, coming back again, that's in the scenario: diabetes, hypertension, elderly, and TURP. Okay. So now I hope you understand what I wanted you to tell. So try to construct your answer that you tell in buzzwords. Okay. So these are buzzwords, and if they want, because you don't know what is their requirement and what they want in the key. Okay. So whatever they want, they will ask in further detail. Okay. So that is the trick answer, because if you will, if, for example, in their key, they have just put it as a only a word, and they don't want a detail of diabetes. Okay. So what is the advantage for you to speak out too much? So initial word, and then anything they want to ask, they will ask you in detail. Okay. Said, how will you control the blood sugar levels intraoperatively? What will you do about hypertension? What will you do about elderly? What you will be do about URP? This is, I hope you understand, same. You will change the disease. Okay. You will change the surgery. You will change the patient group. Okay. So now If you understand this thing, we will change elderly with pregnant. We will change diabetes, hypertension with the myasthenia gravis. Okay. And we will change TURP with the paraumbilical hernia. No, not paraumbilical hernia. Sorry, appendicectomy. Okay. So now who will answer? Any exam candidate who did not speak up till now? Sadaf, are you exam candidate? Hina Sheikh. Yes, Hina Sheikh, you have not spoken out anything.
Sir, I've just joined, so I don't know what
Okay.
is your question.
Yes, so it's a pregnant patient with myasthenia gravis. I think Hina, if you have not listened to what I have said, please, I will give chance to anyone else. And next question, I will ask you. Who want to ask, please?
Sure.
Fahad, you are only writing, master. You are not speaking. You would like to speak? Atif Nazir, who want to answer, please? Abdurrahman.
सर अभी मैंने भी सर अभी ज्वाइन किया है
Okay,
सर
okay, okay, okay. Atif Nazir, you speak out because you are listening to what I was saying. And Abdurrahman, we are communicating in English only because we have some non-natives for us. Please. This is a pregnant patient with myasthenia gravis going for appendicectomy. How will you evaluate?
I will evaluate my patient based on a detailed history, physical examination, and relevant lab investigation, focusing on the physiological, pharmacological, and anatomical changes related to her pregnancy, as well as related to the duration of disease, her medications, her current control, and her previous control of myasthenia gravis, as well as the severity of her surgical condition, the technique being planned for the surgical condition, and the associated anticipated complications.
Okay, so with reference, you are better, but with reference to myasthenia gravis, drugs, either it is this anticholinestrases or an immunosuppressant like steroids and immunosuppressants, and severity in the bulbar and in respiratory muscle weakness, okay, and ophthalmic. So, and then disease duration and any other pulmonary risk factor. So, if these are any of them are there, you are expecting post-op
Mechanical ventilation.
mechanical ventilation. Okay.
Professor.
With yes, with reference to appendicectomy, what would you like to ask?
The duration of disease,
Okay.
the presentation of disease to determine its severity.
Okay.
Patient's general condition or patient's hydration status.
Okay. Because there may be nausea, vomiting.
Hydration as well as electrolyte and acid-base status.
Yes. And then here, because the pregnancy, so
The surgical
duration, and actually, is there any rupture? Is there any mass? Okay. Is it the differential? Maybe it's not appendix, it's ruptured ectopic pregnancy. Maybe. Okay. So lap versus open, nausea, vomiting,
surgical
according
technique.
to surgical technique, of course, lap versus open. Okay. And this one, nausea, vomiting, and electrolyte imbalance, leading to electrolyte imbalance, risk of aspiration. Okay. And pain. And like these are the things which will be there in this case. Okay. So again, you can answer in the same way as I told you that in this patient, there are physiological, pharmacological, and anatomical considerations with reference to pregnancy. There are problems related to the disease severity of myasthenia gravis. Okay. There may be association of other autoimmune diseases. Like myasthenia gravis is maybe associated with other autoimmune disease. So your evaluation will be on the basis of history examination and investigation about these things. Okay. So I hope you understand and how you can answer in a better way.
Professor, thank you. I
Yes.
understand you very well.
Yes.
But we have sometimes problem.
Sure.
For example, the complication is we divide into two: immediate complication and late complication.
Okay.
So I don't want for that, but I need to know what are the factors that can increase the risks of complication.
Okay. Very good. So, like, what sort of complication, immediate and late, with reference to appendix?
No, for example, cesarean section patient. Cesarean
Very good.
section patient.
Okay.
For example, I need to know the factors that can increase the risk of complication,
Okay. Like,
like hypertension.
okay,
Like,
hypertension. It can cause bleeding.
For example,
Preeclampsia.
of drug of for example, drug overdose. For example, overload fluids. For example, all of that. If you have idea, I need to explain for that.
Okay. I got your point. So you are just telling that you have to anticipate the possible complications, and then you will be looking at them. Okay.
Mm. For what?
No. You will be you will be looking at the possible complications, and then you should be looking at the in what surgeries, what complications probably can occur. Am I right?
Okay. But I have another question.
Yes.
For example, one I have a case. For example, cesarean section. When we finish the operation, after 2 days or 3 days, they complain. The patient all the headache is sometimes nausea and vomiting. Sometimes the feel pain, neck pain.
Okay. So that is
What
PDPH.
what is the best solution for that?
So it will be according to if it is GA versus spinal. Okay.
Spinal procedure.
Yes. So spinal. So you have to you will your most probable diagnosis will be PDPH, but you will be ruling out any other cause of headache. Okay. Like there may be some central causes, some thrombosis. There are some other differential diagnosis of PDPH. Yes. So
Okay.
yeah, the same question to all of you. What is the differential diagnosis of post-dural punctal headache?
Sir, it could be subarachnoid hemorrhage, cortical vein thrombosis, simple migraine, stress headache.
Very good. Dehydration itself can cause headache. This cortical vein thrombosis. Okay, migraine. What else?
Rare chance of subarachnoid hemorrhage as well, if patient is
SAH.
hypertensive.
Okay. What else?
Meningitis.
I'm sorry?
Sinusitis, cluster headaches.
Sinus, like differential diagnosis. Yes. So differential diagnosis of headache. Okay. So there may be the problem may be before or maybe after. Okay. So there may be some things which may be there before this happening, like before this cesarean section. So you have to evaluate like if there is anything other than PDPH. Okay. So I hope you are understanding. So any question up till now? Wajiha and or any other exam candidate? Zishan Akbar, Atif, Fatima.
So if we miss anything in our Viva session, like if
Okay.
we miss any investigation to tell, like in previously I forgot to tell them in diabetic patients that complete urine examination I will also check.
Okay,
Then
no problem.
how should and my like all the
Actually,
other things?
Actually, that's why I tell you something, that you should make a default plan, like diabetes and infections. So infection anywhere, maybe it is in the urine, or whether it is in the blood, chances of sepsis, chances of urine infections and everything. So make your buzzword. Again, I repeat the same thing, that it is very difficult to identify on the spot. You have to identify these things before. Like if this is not in your mind that a diabetic patient can have infection, you will definitely forget about it. Okay. Okay. So if you just like we have, because in the preceding days we had covered some of the topics. So I'm just continuing what we were discussing before. So up till now, what I have told you, because if you understand this thing, believe me, every disease have few things, only few things which you should not forget. And if you understand this format is very important, that how you identify what you have to speak out. Because in unfortunately, you are not able to identify what you have to speak, and you are talking irrelevant, too much details, and not telling the main point. Because if you tell, like, just like if you remember way back many years ago, we used to have news bulletin. Okay, not news bulletin like this. News bulletin of 9 p.m. If you remember, in our country, they used to tell in 1 or 2 minutes all the details, all the news, and then later on they used to describe each news in detail. Okay, so the same thing. So if you are just giving a good starter, whatever is in there, because you don't know what they want to ask you, what is there in their key. So if you will waste your energy in diabetes, they want to ask more of about TURP. They don't want to ask too much details about diabetes. They don't want to ask too much details about hypertension. So make your answer prepared in a way that you don't miss these things, because there will be certain type of questions which are direct questions. What is scavenging? What is humidification? What is the working principle of vaporizer? These are direct questions. Okay. Or if they are asking what is rapid response team, what is continuous renal replacement therapy, these are direct questions. So answering these questions is a little different from scenario based questions. Direct questions, if you know, you can speak out. The scenario based, and actually if I just chalk out of because we have 60 minutes each viva for table viva, even if it is long case or even if it is other exams like EDA or any other exam, usually one scenario is for 5 minutes. Okay, so roughly they are asking around 20 scenarios usually in a table viva. So out of those, sorry, 20 questions. So out of 20 questions, I can guarantee you that about 12 to 14 questions roughly will be scenario based. 4 or 5 questions will be only which are direct questions, and that will be maybe from pain, maybe from ICU. Okay, so it's like that. Okay, so
Yes. So in
you
long case in examination, if we do all the airway, respiratory, CVS examination, but if I don't tell them prayer sign in a diabetic patient, that also that is also a negative
yes.
failing.
So in long, the difference between long case and table viva is only that what I am making you learn. Evaluate the patient on the basis of history, examination, investigation. This part you have to make in a little detail. You are taking the history, you are doing the examination, you are asking for investigations, you are exploring these three things. Ultimately, whatever data you got, ultimately you are making cardiac risk factors, renal risk factors, pulmonary risk factors, PONV risk factors, aspiration risk factors, okay, difficult airway risk factors, okay,
भाई साहब
difficult
कंप्यूटर
IV
खराब है
line.
यार वो तो सेल कोड गया है मेरी भी यहाँ पे खराब हो गई
Please keep the mic muted. It's very irritating. People don't understand that you are in public forum. Please try to be a little responsible. Okay, difficult IV, difficult airway, as I told you, anything. So this thing should be in your mind from the start of the anesthesia to the end of the anesthesia. Okay. So the steps of anesthesia are, if I just tell you that you make a format like it is pre-medication, which is angiolysis, acid prophylaxis. Usually, it may be something else. And third will be preemptive analgesia. Okay. Then monitoring. Any other monitoring other than standard 1, standard 2. Never forget to tell. Then induction agent, muscle relaxant. Okay. Then stress response. Okay. Then maintenance, analgesia, fluid. Sorry for my bad writing. I'm not expert in writing through my this stylus. Anyways, fluid. Okay. Then any complication, intraoperative, or you can use the word complication or critical incidents. Incidents or critical step. Like what can be the critical steps in anesthesia in any, this is I'm telling you generally, any bleeding, any hemodynamic instability. It may be hypotension, hypertension, tachycardia, bradycardia. Okay. There may be embolism. Okay. Tourniquet. Okay. Hypoxia, or anything related to airway. Like you can think about things and it can occur. So things related to tourniquet, things related to bleeding, things related to hemodynamics, hypotension, hypertension, tachycardia, bradycardia, arrhythmia, any embolism, tourniquet, hypoxia. Okay. And then, like for example, we can think about critical steps, like similar to tourniquet, if they open a clamp. So anything in which they are putting a clamp or unclamp. Okay. Then vagal responses. Now you can think which surgeries can have vagal responses. So any surgery in which, like eye surgery, mastoid surgery, laparotomy, any surgery in which orifices are involved, like genitalias, pelvis, rectal. Okay. So in which anything in which vagal responses can occur. Cervical dilatation. So this is a critical step. Like if you know that if they are doing a certain step and there will be bleeding. Okay. Then another thing, pain. Pain is a critical step. Like they are doing something which will cause more pain. Like for example, because there are two basic parts of pain, what is somatic and one is visceral. Okay. So somatic pain, usually, for example, if you are having a dental surgery, if you are having a orthopedic surgery. Okay. If you have anything in which there is more component of somatic pain, then you can expect any specific step of anesthesia you should be knowing. So induction, and same step will be for recovery. And even in recovery, what complication can occur usually in PACU? So these are nausea, vomiting, pain, again the same hemodynamic instability. So you have to think, rather than cramming your pages of a specific topic, you should know a format. Okay. So I will show you, which is there in the Google Drive. If you have not seen it, I will suggest you to have a look. This is what I was telling you: pre-medication, monitoring, induction, muscle relaxant, maintenance, analgesia, fluid therapy, recovery, and post-op course. This is like, instead of reading any topic separately, you fit your topic in this. Like Hina, please, Hina, I would like you to speak out, please. Like if I give you a example of sickle cell disease. How will you fit in this format? What is the category of sickle cell disease? What is it?
Sir, sickle cell disease is an autosomal disease of blood in which there is a single chromosome change of amino acid. Glutamic acid is being replaced with valine. So we have the goat sickle cell disease, and
Very good.
physiology, and
You
it
know,
has
I have to give you Electra. Okay. And do you know why? What is sickle cell disease? If I want you to tell me the first thing, what is sickle cell disease? What you should tell? This autosomal, or you should tell something else?
anemia. It's anemia.
Thank you very much.
Basically.
Isn't this anemia? So did you tell up till now in the time when I interrupted you, did you tell that it is anemia?
No, sir.
Okay. So whenever there is word anemia, it is whether because of production, destruction, or loss. So here, which category you can fit in? Because it can be more than one category in sickle cell disease. Is it problem? Because sickle cell disease is a chronic disease, okay, and it is of course, it is a hereditary. So it's a genetic or hereditary disease in which there is not only production problem, okay, there is because of the weak or fragile hemoglobin, it can break down. So there is hemolytic crisis as well, okay, and it can cause vasoclusive and sequestration crisis as well. And because of chronic stimulus to produce more and more hemoglobin, there may be the shutdown of bone marrow. So that is called as aplastic crisis. Okay. And then further category which you should not forget is chances of embolism and infarcts. Am I right, Hina? Can you listen to me? Are you
Yes,
there?
sir. Yes, sir. Sorry, my mic was mute. Yes.
Yes. So in this word, now you can speak out again. You can practice, and then you can put it the same all the diseases. So diagnosis of disease, how sickle cell disease severity is diagnosed or managed. How will you say? Yes,
Yes, sir.
please, Hina.
Very good.
Hina, want to speak out, please?
Yes. Yes, sir. Diagnosis is being made of. I'm not sure, but maybe
Why you are not
electrophoresis
sure?
or
No. I cannot listen these words now. And you should not speak out these words now. Okay? Exam is very near. So
yes.
think where its answer is very simple.
Hmm.
They do electrophoresis
Yes.
or sickle test.
Sickle test. Yes.
Okay?
Yes, sir.
And then evaluation of the systems involved, or what you do, hemoglobin S levels. Am I right? In the electrophoresis, and your target is how much it should be in the, like for elective surgery, how much should be the hemoglobin S level?
Less than
Less than 30%. Okay. So if it is not less than 30%, what you can do? First of all, your answer should be extreme transfusion, but your answer should be that I will consult hematology and I will follow their advice. And the options will be extreme transfusion, fresh blood transfusion, and like that. Okay.
Yes, sir.
You have to bring other specialities on board. Okay. And then now evaluation of the other systems. You will ask which questions you will ask about other systems. Remember one thing, Hina. If you will only try to speak out the books, believe me, it will be a problem. Like your tape recorder, when I asked sickle cell disease, you put switch on the button and the Morgan page number, etc., is started in your
Pustikat. Ano ista? Igan, igan.
actually this is not the answer. Okay. So what you should tell in the different systems, how will you evaluate? By the way, which systems are involved? We have just spoken out just now.
So it can involve the CNS system, CVS, renal, liver, bone marrow.
Okay. So you just have to tell these things. Like there may be some infarcts, there may be
Yes.
any neurological changes. Okay. There may be acute abdomen, priapism. Okay. There may be, if there is a hemolytic crisis, there will be an increase
Pain.
in bilirubin.
Hmm.
So again, my humble request to all of you, please come out of bloody books. I'm sorry to be very frank, but your reason to fail in Viva is only sitting on the books like a hen. So please come out of books. If you will try to just cram the books, I'm sorry to use the slang word, but I just want you to understand this thing, that whatever you read from books is useless till the time you don't speak out. Okay. I'm not saying that this is a ultimate format. I have just made it with my mind. You can make it your own. Okay. There is nothing special. And now you see, you can put any disease here. You can change sickle cell disease with asthma. Asthma is a reactive airway disease. The pathology is either vasomotor or allergic, and there is some genetic tendency as well. Okay. And severity pathology, I have told you, there is mucus production, there is bronchoconstriction. Okay. And mechanism of problems, I have told you, this is the mechanism of severity, either with the history, how much attacks, how they are, how much use of inhalers,
Medication.
how much nebulization, how much any hospital stays on, etc. Okay. And then other systems which can be involved is when the patient, any medication whatever the patient is taking, it can result in tachycardia related to cardiac problems, tremors. Okay. So these are the, so this is how you will go. You can have a chest x-ray, ABG, whatever you want to say out, pulmonary function test, whatever you want, you can put it in everything. Okay. So cardiac problems will come, airway problems will come. What will be the problem with related to airway? The airway hypersensitivity. You have to make sure you don't manipulate the anesthesia airway in light plane of anesthesia. You try to avoid supraglottic. You try to use supraglottic, or you try to have regional anesthesia. So this is how you have to think and speak out. And if you will speak out, believe me, anesthesia has very little anesthesia. Anesthesia has everything other than anesthesia. And remember, when we were in medical school, we used to have same diseases like today, and they have never changed. Thyroid gland was in 1999, when I was in medical school, I started, it was in the neck, and it's still today in 2025, it's still in the neck, and it is producing thyroid hormones. So it's very simple. Don't make your life difficult by try to think something out of the world. Try to be very simple. Very things are not difficult. You can put any disease, and you will find in any disease you will put it in everything. So now your answer will be prepared, and I'm
Sir,
100%. Yes.
So not necessarily every examiner will be taking the like Viva on the same pattern. Maybe they just want some bookish knowledge. No.
No. Remember one thing, but but tell me one thing. What do you mean by bookish knowledge?
Bookish knowledge, like you have asked me sickle cell and I haven't revised it yet, so I was not able to collect the things and I was not able to produce my answer. But if we have the knowledge from books, then we would be able to like say something. No,
Like, look, you can say eyes cannot see what mind does not know. Okay. So you will only be able to identify if you know in your brain that what you need to know. That's what I'm trying to tell. Of course, books has not poetry of Ghalib or Allama Iqbal. They have the knowledge, but how how to extract the knowledge and how to reproduce it, that's need an art. That's an
Yes,
art. Okay. So what
yes,
I'm
yes,
trying to
yes.
tell you that of course you have to tell from the book. I'm not saying that book has written something slang. Book has, but books will be useless if you don't practice. If you don't understand what you have to answer. Just tell me one thing in which book these things are written in that way. I'm
No,
sorry,
not
there
in
is
a way. Yes, yes,
no
there is
book
no
has
such
written
book.
like that. So that's a problem. Okay, that's a problem that in the exam they want answers like this. They want to know from the pre-op evaluation to the post-op care, and no book is written like that. That's the problem. As much you worship Morgan, you will never be able to answer these questions, and that's the reason why
Yes,
people
yes.
fail. That's the reason why people fail. Okay. So the first question, whenever you are getting any data, you think what are the things that are important things? And believe me, these important things are bookish. They are bookish. The only problem is that for example, if myasthenia gravis, if you are evaluating a patient for myasthenia gravis and you don't remember this point, that you have to identify 5 or 6 points which are written in the books, of course, that the patient has severity, dose of the pyridostigmine, any other pulmonary risk factor like smoking or COPD, or disease duration more than 6 years, or a dose of pyridostigmine, things like that. There is some bulbar weakness or that. So in these cases, you will be expecting more complication. You will be expecting the patient to have post-op ventilation or post-op ICU problems. Okay. So that's how you fit any disease. You name any disease and you can fit it in that format, and then you will not forget. Thalassemia, sickle cell disease. Then you come to other diseases. You can come to any disease and you will find like that. Thyroid, hyperthyroidism, hypothyroidism, thyroid crisis, myxedema, coma, cardiac problems. So, like we can discuss each and every disease, but my always I try to focus on these things, because if you understand this thing, believe me, you are not dumb, you are not duffers, you all are intelligent people. But problem is that you try to cram the words, and this is in your genetics, that examiners are there to listen from the book. I'm sorry, this is wrong. Okay, this is absolutely wrong, because Alhamdulillah, I have failed a number of times, and only then I understand how to pass the exam. Okay. So my suggestion to you, do like this. It will
Yes,
become
sir. Thank you.
easier for you. Okay. So that's what we discussed. This paper you can alter, you can make your alteration at you by your own, and you will find it uh, much helpful for both this one long case or table viva. Okay.
Yes,
So
sir.
okay, so the few words about pain. Okay, few words about pain. If they ask you, like they can ask you about any surgery. Okay, so you should have a analgesia plan for common surgeries: appendix, laparotomy, thoracotomy, mastectomy, knee surgery, shoulder surgery, hand surgery. So how you can answer in a better way related to analgesia? So you will answer that it's a multimodal analgesia plan. Okay. So who will answer? Uh, Abdurrahman, you want to answer? You did not speak out anything.
Yes, sir.
How will you make a plan for analgesia? What should be the answer?
Anesthesia plan for pain management.
Yes.
It would depend upon the patient's on the proposed surgery,
Very
and
good. Like the surgery and surgical manipulation and level of surgery. Okay. Which level of anesthesia or analgesia is required for that specific surgery? Very good. This is one thing. Then,
it will depend on if patient is already taking some medicine, if he has already a pain problem, if he has
okay.
a chronic pain problem or not, if he is on some medicine. Uh, if some medicines which should be contraindicated, like if he has kidney failure or liver failure or respiratory problems, which should be avoided. And
Like you can say that because all the medications will be handled in the fluid compartment, will be metabolized by the liver and excreted by the kidneys. Okay, so you have to look into these three things: that how is the fluid compartment. Fluid compartment means free drug, volume of distribution. Okay, the drug which you are giving, where it will be going through the liver, through the kidneys. Is there any history of allergy, tolerance? Okay, as was you were telling, that the patient is taking any medication, so there will be some tolerance. So your analgesia plan will be according to that. And patient demographic, like age group. Okay, and possible
yes,
complications. What are the possible complications of pain medications? Is that either it is respiratory depression, okay, either it is hemodynamic instability, allergy. I have told you, allergy, anaphylaxis. Then some medication, they can cause bleeding. Okay, some medication, like for example, what else? Like opioids related problem, pruritus.
yes,
Okay,
sir. Respiratory depression, organ
ileus,
failure.
ileus. Okay, so like these are the things which you should be thinking whenever you are telling about analgesia. These are the things which should be in your mind when you are answering the question. If you know these things, whenever you will be answering, your answer will be very accurate. So now what are the combination? Like combination will be paracetamol, NSAIDs, okay, opioids, regional anesthesia. Regional anesthesia, you can divide it in central neuraxial block and peripheral nerve block and compartment block. Can you tell some of the compartment blocks which we use in anesthesia?
Wire block.
Tab block.
Pex block, tab block,
Hmm.
rectus sheath block,
Rectus
Ira-
spiny block.
serrator, serratus anterior. No, plexus block is peripheral nerve blocks. Okay, they are, because the difference is that in the compartment block you are not blocking a specific nerve. Okay, in which you are giving a high volume erector spiny block. It's also a compartment block. Okay, so tab block, QL block, these are all compartment blocks. Okay, in this, when you are not targeting a specific nerve or a specific nerve group. Okay, so you are just, so central neuraxial block may be spinal, epidural, caudal, saddle. Okay, and also which is not a central nerve block, that is not a peripheral, not a compartment, is paravertebral block. It's sort of in between. Okay, yes, we missed in these problems because Fahad is only messaging, but he is messaging very nicely. Okay, so neurological problems. So neurological problems are also very important with reference to. So whenever you are telling, you can now, for example, if you know that if you are using Presidex, dexmedetomidine, and it has hemodynamic problem, it will cause bradycardia, it will cause hypotension. You will be careful. Okay, if you know that. By the way, what is difference between respiratory depression and respiratory failure? Yes, Hina.
Depression is sort in the form of hypoventilation, where
Very good.
everything are intact, PO2, PCO2 is not affected.
Like this is the response, the ventilatory responses to some things. Okay, ventilatory responses to oxygen or CO2 usually. So this is called respiratory depression. Like any hypnotics or opioids, they cause respiratory depression. And respiratory failure is how you can tell respiratory failure?
When the lungs are not functioning properly,
Lungs are not.
Hypoxia,
मतलब the
hypercardia.
system is not working properly. उसमें आपका in respiratory
Mus-
depression,
Mechanics. Actually,
yes,
respiratory failure is combination of respiratory depression plus something else. Mechanics.
yes.
Okay.
And
Mechanics.
compensating pains.
Sir, failure is the inadequate gas exchange.
Failure is inadequate gas exchange. Yes, you're right. Okay. Like, you can say that failure is depression is part of failure. Okay. So depression is specifically the response of the body to certain triggers of ventilation. So that's what occur with oxygen, and like opioid does not cause respiratory failure. They cause respiratory depression. That's why we always use this word respiratory depression. Respiratory failure may be mechanical. For example, if muscle relaxants effect is there, now it is causing respiratory failure. Patient is not able to breathe nicely. Okay. If there is a sputum, there is obstruction, there is foreign body, these are causing any, for example, pulmonary, pleural effusion or pulmonary edema or anaphylaxis leading to airway obstruction. This is respiratory failure. Either it is upper or lower, whether it is any immunological response or allergic response or bleeding or sputum or anything. So because the number of time they ask in a different styles they ask, but you should be, because remember one thing, there was a candidate who was not sure about difference between laryngospasm versus bronchospasm. It's possible. Okay. So you should be very clear about laryngospasm versus bronchospasm. When the endotracheal tube is there, can laryngospasm occur?
No, sir.
No.
Can something which mimic or which can have the same result like laryngospasm can occur? I repeat my question. If the endotracheal tube is there, can something which is not laryngospasm, but the result is like laryngospasm can occur?
Yes,
Yes,
that's
sir.
bronchospasm.
Bronchospasm.
No. I'm not talking about bronchospasm. I'm talking about laryngospasm. What is the result of laryngospasm? Okay. What's the problem in laryngospasm?
Acute glottic closure of the vocal cord.
No,
You
I'm not asking what is this.
and
What is the effect? Ek minute, let her speak, please, Fatima. You spoke out, so now you complete this answer. What is laryngospasm?
Pulmonary edema.
No, let her speak,
Sir,
please.
it is
Yes.
Sir, it is acute glottic closure of the vocal cord by the vocal cord, so it will
What
cause sudden
happens? What
hypoxia to the
happens?
patient, and there
What
will
is
be
the result?
negative pressure. There
Very good.
will be a negative pressure which is generated, causing a pulmonary edema.
Negative pressure pulmonary edema. Okay, now you think
Negative pressure.
what other thing which is not laryngospasm, endotracheal tube is there, but it can cause a feature like negative pressure pulmonary edema. What is that? What will be that scenario? What is the specific thing?
When the patient is coughing or bucking,
Biting of tube. Isn't the picture like laryngospasm?
Yes, sir.
Okay, so the patient has bitten the tube. So actually, the mechanics are the same. There is obstruction, and the respiratory muscles of the lower system, they are contracting highly, and the negative pressure is generated, and there can be negative pressure pulmonary edema with the endotracheal tube is there. And the bronchospasm is something else. Bronchospasm will be resulting in airway pressures. Okay, airway pressures, and the response will be different. Bronchospasm can occur with the endotracheal tube. Bronchospasm can occur without endotracheal tube. So you have to be very clear what will be the difference between laryngospasm and bronchospasm. In laryngospasm, there will be stridor. In bronchospasm, there will be wheezing. And you should be very clear, sometimes we are using the wrong word, wheezing versus rhonchi. It's a very simple question. What is the difference between wheezing and rhonchi? Yes.
So Ronchi are audible and wheeze is on auscultation.
You are talking opposite. Wheeze is audible, and Ronchi are the one which you listen from the stethoscope. Okay.
Okay.
So you remember one thing. This is very simple, very small things. So you should be knowing about this. So there is a question which they can ask you about upper airway obstruction. So you should know the differential diagnosis, that stridor, that foreign body, this is a crew, okay, laryngotracheobronchitis or acute epiglottitis. So you should be very clear what is difference between these things and how will you manage. Okay. Um, Another question which they ask frequently is the differential diagnosis of increased airway pressures. This is a very common question they have asked so many times to so many people. So you should be knowing that how will your approach will be airway breathing circulation. You will check the patency of the tube. You will do the bilateral auscultation. You will see whether there is inadequate analgesia, inadequate anesthesia, muscle relaxant effect is finished. You will see the hemodynamics, whether there is pulmonary embolism, there is pneumothorax. Okay, so any problems in the circuit, and then you as someone who was answering, that resuscitation, evaluation and management will go side by side. Okay, so you saw everything, then you thought that there may be spasm, so you are giving through the bronchodilators, through the endotracheal tube, the puffs. Okay, or next step, you can increase the depth of anesthesia. If the hemodynamics are good, you can increase the depth of anesthesia, because sevoflurane itself has dose dependent bronchodilation, and then you can go further like that. Okay, so that's how you have, because you know what will happen suddenly in one scenario, they will be asking about so many things, and if you are only in the books, you cannot answer these things, believe me. I can guarantee you. Because when I used to do no, I like, you cannot believe now, I even don't sometimes believe that I am the same person who used to fail so many times, because I don't know how to speak out, and I used to become totally as if I'm not able to speak when they ask the questions. So if I can believe me, when sometimes I speak, I forget, and I say just thanks to Allah that Allah can make these miracles like this. That if I can speak like this, you can speak even better. Okay, you just need some practice and you just need confidence. When you go to the Viva, please be very confident. Sit like you don't make yourself curls and bending like you, as if you are not a something nice. And then you have to look into the eyes of the examiner. Okay, you should have a smile on your face. You should be looking like a doctor. You should be looking like a consultant. Okay, so these are things which matter a lot. Even when you are there, you should be looking nice. That's a very important thing. Okay, so I think um, any question you want to ask, because we will have some more sessions like that. I tell you something, because topics are the same. Okay, you just have to identify what you need to know. Just a second, where it is. Because in separate topics, separate you can answer, because I'm sorry, I just slipped out a little bit, that with the reference to analgesia, if you have to answer, you will make your answer like that. You can start with the paracetamol if there is no contraindication, NSAIDs. Okay, and then further plan will be either you will be giving IV opioids, and then you will be giving post-op opioids with PCA. You can give some blocks. Okay, you can use ketamine, low dose of ketamine. You can give this dexmedetomidine. You can use IV lidocaine. You can make a combination of these, this one. And then alongside, if any surgery in which you can have any central nervous block, like spinal or epidural or caudal, you have to tell that. Any compartment block. So you make your plan for all the surgeries, all the possible surgeries, that what you need to answer in the exam. Okay, like shoulder surgery, you have to tell that you can give interscalene block, or you can give superficial cervical plexus block, because some of the roots will be missed if you have given this one. Then for similarly for all surgeries, like if you are telling about hip surgery, you can tell that I can give this Pank block, I can give this sci-fi block, okay, femoral nerve block, 3 in 1, okay. And then for knee surgery, because there is a concept of ERAS, so you will try to have motor sparing blocks. So you will be giving adductor canal block alongside local infiltration in the joint and everything. So this is how you have to plan. So you should know all the surgeries. I have made this a possible list of a lot of surgeries. A lot of things are common, so you don't be afraid from the number of surgeries I have written here. You can just make common list of common surgeries. A lot of things will be common, okay. So because I have discussed a lot of topics before, so you can find out here, because there are out of OR anesthesia. This is a topic they can ask you. Okay, all the physics and equipment topics like scavenging, humidification, and answer. Remember one thing, even in direct questions, the simple physics equipment, you should know what is that thing. Like what do you mean by scavenging? What is the advantage of scavenging? What are different ways to do scavenging? Same for what is the rationale of doing humidification? What are different ways to do humidification? What are the limitations of any process, any technique? Okay, so these are the questions which they can ask you for anything like that. What is the working principle of pulse oximeter? What is working principle of end-tidal CO2? What is working principle of vaporizer? What is working principle of everything? What is working principle of diathermy? What is working principle of so make your questions pre-hand rather than reading each and every line. They will be asking you the same question. What is the working principle of radiofrequency ablation? What is the working principle of cryoanalgesia? Okay, so Joule Thomson effect, and a gas is ready to expand suddenly which is under high pressure, and it will cause cooling. The answer should be like this. Similarly, radio frequency ablation, what is it? Diathermy, what is the working principle of diathermy? So make your answers like that rather than reading and reading. Try to make the questions out of that topic, and believe me, if you that will become very easy, because then you know what you will be asked. Same questions will be asked. There will be nothing. And another thing, if they are asking something out of the world, this is usually not the failure point. Very simple concept, or at least you can, you cannot read and cram each and everything. The only thing which is in your hand is to make your concept in a way that you can answer anything. Okay, so thank you very much. I think it's enough for today. So tomorrow Dr. Fazal will be taking any class?
No, sir, I don't think so.
Okay, so tomorrow I will, in the afternoon or evening, I will give you some time and we will have another session. Thank you very much. And please,
Sir, thank you.
all of you are welcome. Please don't hesitate to ask, but like you are reading any topic and you have any query, please don't hesitate to drop a question. If I will not be able to answer at that time, I can answer you later on. Okay, so this is my number. A lot of people know me. So you don't hesitate to ask, and rather again, I will say, please speak out. Speak out as much as possible. Stay
Sir,
in front of the mirror and speak out. Whatever you are studying, speak out. Studying, speak out. And this is a request for you. Make a list of all the diseases and make a 30 seconds answer for that disease. How will you compile the answer? How will you speak out about that disease in 30 seconds to 1 minute? Same thing. So because in the exam, they will be asking you, or you will be asked to answer in that way. Not too much details. Not too much details. Okay. So, because I have passed through these things, so I know that what are the fears in your mind. Okay. And sometime when you fail, even you don't know why you failed. Okay. So
yes, sir.
I don't think that they fail you on something. They will ask you a very silly question and they are failing you. Okay. Because in every exam there are something they will say, oh, they asked about match test, they asked about ISPAC test, and they failed me. No, it's never like that. Your performance will make you fail. The examiners are not your enemy. Even if they are the worst people in the world, even then they are not there to fail. Believe me, they are there to pass you. Yourself fail. They don't fail you. You fail yourself. And you should not have anything in your bad in your mind, because if you don't, because negative, this will make you negative, and then you will not be able to perform even. Okay, so try to be confident, try to learn as much as possible, and don't take over stress, because if you will try to read each and every line of books, unfortunately, how will you remember? How will you remember? Like, for example, if you are reading another thing just struck my mind, make a list of calculations, just that what sort of calculations they can ask you in talks. So this is one list. What calculations? How to make the oxygen content, how to make the this hemophilia A corrections, okay, how to make the allowable blood loss. Very simple calculations. How to calculate the remaining volume in the cylinder. These are maybe 50 to 30, 40 calculations in the whole anesthesia care. Then make a list of complications and then tick one by one. Hypertension, tachycardia, bradycardia. Make a list of all the complications which can occur. So similarly, make lists of certain things. Then it will become very easy for you. Okay. So I used to make a lot of lists. Rather, when used to have a group study, I was the one to make the lists. This was my duty. Anyways, thank you very much. So tomorrow, most probably around like same time, I will take a session. Okay. So thank you all of you, and we will
Thank you,
meet.
sir.
And I will suggest you to listen to the recordings, because I
Yes.
unfortunately not every time I get as much time, but I in the previous years I have covered all the topics. So just feel free to ask anything anytime. Bye bye.
Yes, sir. Thank you, Allah Hafiz.